What do you think of when you hear the word inflammation? Well, if you're like most people, then just hearing that word automatically conjures up images of something negative. We start thinking about things like injury, swelling, and pain. All the time we're hearing about the harmful effects of inflammation and the damage that it does in the body, but we rarely hear about all the good that inflammation does, or the fact that it is a critically important part of a defense mechanism that is vital for keeping us alive and healthy, and that research shows that when you artificially tamper with the inflammatory process in the body, you can get some disastrous consequences. Well, this week I brought in an expert on the subject to talk all about the pros and the cons of inflammation and the best way to deal with it. Let's get into this. Welcome, everyone. We have a very special guest today. Dr. Isaac Eliaz is a leading expert in the field of integrative medicine. He specializes in cancer, detoxification, immunity, and chronic complex conditions. He's a respected physician, a researcher, educator, and a mind-body practitioner, not to mention best-selling author of the book, The Survival Paradox. Thank you so much for being here, Dr. Eliaz.
Thank you. Thank you so much for having me. I'm looking forward to this interview and to the discussion about such a, not only an important topic, a topic that really affects everyone. You know,
Yes.
it's part of the life of so many people, and there's so much to say about it and so much to understand it and so much that we can do about it.
Very well said. And I love that you said there what we can do about it. So I'd love for you to just start off explaining what is the survival paradox?
So the survival paradox really offers a new paradigm to our understanding of health and disease. It's a result of, of over 40 years of studies and clinical experience and meditation and research. And what it really presents is that we all recognize that we are innately built and wired to survive, every cell in our body. And this is why we are alive. But the mechanisms that we use to survive are the same mechanisms that will actually shorten our life and cause inflammation and cause pain and cause suffering and affect the quality of our life. And this is built within us. Our survival response is automated through the sympathetic nervous system. And as such, it starts in a fraction of a second, as you know so well, with your work, with the nervous system. And as it starts, it will either create a fight response or a flight response. Mm-hmm. And we can counteract them relatively easily through deep breathing, through meditation, but they also create a biochemical response that is not so easy to turn off. Mm-hmm. And the biochemical response of fighting is inflammation. And the biochemical response of flight is isolation, creation of microenvironment, and fibrosis and organ dysfunctions. So these very basic movements are a result of our survival response. So our life's journey is really to learn how to transform the survival response and connect with the parts within us that thrive, that open up, that show themselves when we are not in a survival response. And one of the key things that can drive a survival response and can be a result of a stuck survival response is pain.
Very, very well said. I want you to dive a little bit deeper on one part of what you said there, which is the body is initiating this survival response, of which we have inflammation and these biochemical changes, and pain can be a manifestation of these things. What triggers this response in the first place? Is the body making an error, or is it coming on for, why does the body put it there?
No, the body is literally under survival strain. Either it got exposed to toxins, mm-hmm. It got exposed to infections, mm-hmm. It got exposed to trauma, physical like an accident, emotional, psychological. Mm-hmm. It has genetic and epigenetic, especially epigenetic driving forces that are triggering a response that may not be related to the moment. And the body knows it has to cope with it. And it copes with it by trying to repair the situation. And very important for people to recognize, we always do the best we can at the moment. That's very important because it allows us to let go of guilt feelings and why did we do it. The body always picks the best it can in the moment. The problem is that what we did 2 years ago, 5 years ago, 30 years ago, or 10 generations ago may not be what we need now.
Very well said.
And
yes.
So that's really a response. And the biochemical response is driven by specific proteins called alarmin. I call them the key one, galectin-3, which I've been researching for almost 30 years, our survival paradox protein. And by starting the survival response, it triggers a cascade of events that can be extremely damaging and really is affected. It's kind of mind-blowing in practically every chronic and acute disease.
Yeah. In your book, you talk about many different conditions, and you talk about how inflammation plays a key role or may even be at the root of those conditions, whether heart disease, cancer, some of the things that you discuss in the book there. Certainly pain is a manifestation of those things. And you mentioned something just a second ago, that the body's putting inflammation there to repair the situation. So how does this thing that the body's putting there, doing the best that it can in that situation to repair something, turn into something bad? Or what's the switching point?
Great question. So ideally, the body can repair with minimal inflammatory response. If you look at in utero or in, babies like infants very, very young, if they get a cut, they repair very quickly without a scar.
Interesting.
Right? Without a lot of redness. It gets repaired very, very quickly. As we age, our repair mechanisms become less efficient. Why? We have more toxins, we have more traumas, we are carrying more responses than what is really needed, and we're not able to turn it off. So for example, galectin-3 will start the cytokine response, but galectin-3 will not turn off. Once it doesn't turn off, a cascade of cytokines will come washing us. Example, COVID and long haul COVID, right? So many people have chronic pains and fatigue and cardiac problems and excessive inflammation. And inflammation is not the cause of anything. Inflammation is a response to the survival response. The survival response drives inflammation. Now, you and I recognize the role of inflammation, and now conventional medicine also does, and the COVID really helped the whole world recognize it, but we're looking at something that is deeper. And the problem is that a little bit of over-signaling of the survival response goes a long way. What do I mean? I have a very large NIH grant to study the removal of galectin-3 in sepsis and acute kidney injury. In our animal studies, we are showing that when we induce deadly sepsis in animals, galectin-3 goes up by only 50%, or it doubles, but very quickly. As a result, interleukin-6, for the people who are listening, one of the main drivers of sepsis and inflammation and acute kidney injury will go up 1,000-fold or 2,000-fold. And when we block galectin-3 or remove it, we attenuate and prevent the rise of interleukin-6 or make it go down very quickly. We are not treating interleukin-6, we are taking out the cause. And acute kidney injury goes down dramatically. Mortality goes down from 60-70% to 20%.
Wow, that's amazing.
Yeah, and the patients that come to the ICU with sepsis with no pre-existing conditions, their levels of galectin-3 at admission will determine who will die later on in the ICU.
It's predictive of mortality.
Same with a COVID patient coming into the ER. Very large studies.
And do the ERs around the country know this information? Are they testing for galectin-3?
No, they don't. But that's why that's a journey of an innovator, But there's more interest in it. And now that the NIH gave me a large grant to study this, and if I can prove it, I'm developing a device that can move galectin-3 from the plasma because, in such emergency situations, regular oral medication doesn't work, or supplement. You got to, it's an emergency. Yeah, there are 11 million people who die from sepsis every year in the world,
Wow,
So
that's amazing.
a lot. It's a very important project. But understanding the survival response and how it drives pain, because when you have inflammation, you have changes, in the tissue, and I later on give a little bit more of a poetic description so people can really absorb it.
Sure.
Then you get swelling. When you get swelling, everything stretches, you get pain. But also, when as a result of the isolation, you get a microenvironment without oxygen, and you get hypoxia, and you get fibrosis, and everything can't stretch and move. You
So
also get
explain the isolation part for the lay person who's not familiar with that terminology.
So when we are in danger, when we are surviving, we either fight or we run away. When we run away, we don't want to be seen by the danger. So how do we do it? By hiding. And we hide. So how do we hide? This protein called galectin-3, it has a place where it attaches to different carbohydrates, different ligands.
Okay.
And then five galectin-3 creates a pentamer, and they attach to one another and to the cell membranes. Okay. And now you practically have a lattice formation, a coating. Now, in this coated environment, there is not the same quality of circulation. There is not the same quality of clearing of the lymph system.
I see.
The receptors on the cells are changing because it's times of danger. So we shut certain pathways that usually we use to get nutrients. Okay. And we change our metabolism. And the whole extracellular, which drives pain, membrane behavior, and cellular function shifts, which result in changes in energy production. Okay. Which becomes faster because it's an emergency, and extremely inefficient, 5% efficiency, 6% efficiency, with a lot of byproducts like lactic acid, which one produces pain, right? Contraction and pain, and two, drive even more lack of oxygen. We then have the cell excrete more of these factors called hypoxia-inducing factors, and it's a vicious cycle. And you know it so well. Somebody has pain, and it's a vicious cycle, and you adjust them or you balance them, and suddenly what really happens? The area opens up, right? That's really what happens. They get oxygen. Okay. pH changes, and suddenly, oh my God, the pain changes, but the pain changes in one area, and then suddenly it started changing in another area. And suddenly their digestion gets better, and they can think better because the body is interrelated. So the survival paradox and this paradigm offers a truly holistic understanding of relationship before we get into the biochemistry. And when we do this, then the understanding of biochemistry, of nutrition, of whatever method we use become more precise, more powerful, and more meaningful, because the body knows there is more things that can be changed. It's not only that the physical pain can change, the emotional pain can change, the psychological pain can change, the environment around us can change because we're not in a survival mode, etc., etc. But pain is the alarm that tells us that something is wrong, right?
Sure, absolutely.
And in this sense, it's an alarm, but it's also a consequence. And that's why this is such an important topic what we are talking
absolutely. About. And so I want to, because you're an expert in inflammation, this is one thing that's really been very exciting for me to connect with you about, is this paper that was published in the journal Science Translational Medicine last year, 2022, found that people who were taking non-steroidal anti-inflammatory drugs, they actually did transcription analysis of their genome to see what genes turned off and on in a group of people that were suffering with back pain. And they found that the group of people that tampered with their inflammatory response, they were far more likely, first of all, their genetic expression was wildly different. They expressed something like 1,700 different genes than the group that recovered from their problem. And the group that was artificially blocking their inflammatory response, they were far more likely to have pain 2 to 10 years after the fact when they were taking nonsteroidal anti-inflammatories and corticosteroids, which for the audience, both of those drugs target different parts of the inflammatory response. And what you talked about earlier was galectin-3, bringing those levels down, how that had a huge effect on IL-6. So my question to you, and I think you're the perfect person to answer it, is what's the difference between inflammation that is needed and inflammation that is too much? And how do we know when we're interrupting it in the right place that yields a helpful outcome versus interrupting it in the wrong place where you're arguably making the condition worse?
First of all, it's a great question. The difference between blocking galectin-3 and taking anti-inflammatory is greater than the difference between day and night.
Wow.
Okay?
Please
Because
explain.
when you block galectin-3, it is still expressing itself where it's needed. That's the beauty of it. But you are blocking the cascade, exactly what you said. When you block an anti-inflammatory by suppressing the final expression of inflammation, which galectin-3 is so many levels before, you are suppressing the body's ability to heal.
Yes.
And therefore, acutely, the person will feel better.
Yes.
But on a long-term basis, the specific things that didn't heal well will make you have more pain. For example, when you look at every chronic disease, you look at autoimmunity, when you look at cancers, when you look at even patients on dialysis, the higher their galectin-3 in the blood, the sicker they're going to be and the faster they're going to die. Very different, okay? So galectin-3 drives inflammation. It drives. And I am in many levels responsible on one good way for making this very important discovery, that blocking galectin-3 with modified cyprospectin with spectosol attenuates inflammation. That by blocking galectin-3, you can attenuate inflammation and fibrosis. It's much bigger than me. There are so many papers on it now. You know, I do have the patents. I discovered it. That's one thing. Yet my other responsibility is, because I was too busy, is not sharing it with the world actively enough. And the third thing, I'm not part of formal academia. Now, I do get large NIH grants, which are not easy, but no, they say first they ridicule you, then they fight you, and then they say it's self-evident. So now I'm more in self-evident, what I call it a 30 years overnight success, you know?
Very well.
So right now I'm in this place, and that's why I feel I need to share it, because for me, it's not only the pain, it's changing our life quality. I know how I fall into pain, and I'm driven by limitations that are genetic and epigenetic. You know, we discussed a little bit about before the interview. And in my book, I tell the story about the Holocaust.
Yes.
That since I was a child, and I was always interested in spiritual things and deeper understanding on my own. I'm more like an aberration in the family, but I had upper back scoliosis and very strong pain in my middle of the chest since my teens. And I was already doing yoga and martial arts, you know, taekwondo, and I was a yoga teacher, but I always had this pain. And I always knew it's not my pain, but it was so intense, I would just barely touch the middle of the chest and it would be so painful.
What do you mean that you always knew it wasn't your pain?
I knew it's something that I got. It has a bigger meaning than just a physical pain.
Huh, interesting.
It also would trigger emotions, you know, sadness, and holistic healers would comment on this, you know, you're carrying a lot of grief, but I didn't connect it. I said, okay. And I'm named after my grandfather, who is called Isaac. My grandfather died at the age 52 from stomach cancer. And almost 50 years later, when my grandmother died in Israel in 2008, we were on her grave site, and my mother suddenly says, You know, 10 out of the 12 siblings of your grandfather told all of us were killed by Hitler. We were never told this. He never spoke about it. He held it in his stomach. He died from stomach cancer. And I many times could feel that I'm holding his pain. And when I did my work with meditation, with healing, with forgiveness, with acceptance, it was sudden. In one day, gone.
Wow.
And since then, no matter what, I have no pain in my chest. I can press as hard as I can. Now we're talking about after 50 years, okay?
Wow.
So what happened? This was representing a multi-generational epigenetic expression. When I healed by going through a deep process of acceptance and forgiveness that relates to the Holocaust, my mother, who didn't know about my process, was able to suddenly watch programs about the Holocaust in her 80s. She was never able to watch before.
Wow.
This is the power of multi-generational healing. And pain is a sign that something is wrong. So when you give Advil, you just numb the pain. Now, I don't want to take away the value of Advil and the value of numbing pain, because when pain is very intense, it can really limit our healing. There's a whole big thing about our relationship with our pain that I've worked a lot, because I've had pain most of my life, you know, and I've done quite a few things if you look at what I've done, you know. So pain didn't limit me, but it's not like I didn't have it. It's our relationship with our pain is a whole journey. It's multifaceted. That's why I told you I love this topic. But the Advil allows us to take a deep breath. It gives us a gap. What we do with this gap is a very big difference. Somebody can take the gap and try that now they want to try opiates and kind of put their life towards a trajectory to misery and end, you know? Or somebody say, I got a gap. I'm going to call Dr. Whitten and see what he can do for me. And they use it as a gap.
Yeah.
Because now they can take a deep breath.
Yes.
And they can actually think clearly.
Yes.
So please, for people with pain, don't feel guilty or bad when you're taking anti-inflammatory. But if you take an anti-inflammatory and you take a Pectasol, now you are starting to address pain in a very different level. And one of the things we see with galectin-3 blockers over time, and we didn't know it initially, is that pain is getting better. So the interest in galectin-3 was purely cancer in the early and mid-90s.
Okay.
It took a long time. Only now I presented our multi-center trial in biochemical relapse of prostate cancer in the big ASCO GU conference 2 weeks ago. And only now we demonstrated in larger studies 90% benefits after 18 months. Wow. In biochemical relapse of cancer. Wow. But when I developed modified cytospectin, I was starting to give it to people, the most common feedback was my joint pains are getting better. My memory is better. My head is clearer. My blood pressure is improving, you know? And what it was doing, that's when I realized, wow, it's attenuating inflammation. It was one of the discoveries. Yeah. Then we also realized, based on other things, wow, it's removing heavy metals. Modified cytospectin is a powerful chelator of heavy metals, multiple published papers.
Yeah.
And so how did I discover it? After the Chernobyl incident, children had huge levels of radioactive materials in the area of Chernobyl, and they were given high molecular pectins because everything they ate had radioactive material.
So we're talking about the meltdown of the nuclear reactor in Chernobyl.
Exactly, yeah. And they saw levels going down by 50–60% so quickly.
As a result of taking modified citrus pectin?
No, of regular pectin, because it was in the digestion.
Now, in your book, you talk about how the absorption of regular pectin is nowhere near the modified.
Exactly. So it was just partially effective because it was only affecting the radioactive material in the food. Possibly some of it maybe was absorbed. And when you have a lot of radioactive material, it gets it gets recycled through the bile, right?
Sure.
And so there's some benefits. That's why pectins and alginates are binders in the gut, right? Because of the recycling. And that's why I realized, wow, since I can modify it, it's going to be a systemic chelator. And I demonstrated it, reduction of lead, of mercury, cesium, uranium, actually demonstrated it.
That,
So heavy metals will also drive inflammation and pain, obviously.
sure.
So that's another factor why it's so important.
Yeah, let's talk about that in a second, but I want to go back to something you said a minute ago because it was very sophisticated and you went through it quickly, and I want to make sure that people hear what you said. You said, I'm going to paraphrase a little bit, that if you use the gap that you called it, I always call it buying time. If you buy some time by diminishing your symptoms, it'll allow you to think clearly and make better decisions, and then you can work on actually solving the problem. So that's one of the things that I'm constantly trying to get through to people, is that the pain is not the problem. The pain is letting you know that there is a problem. Exactly. So if we can use those drugs, and the way that you phrased it was just perfect. It was extremely sophisticated, and it's uncommon for a medical doctor to phrase it the way that you did. But you were very careful about how you said it. You used it as a gap to decrease the pain so that you can focus on the problem. The other half of what you said was, if you use that alleviation, and I got the image in my head of like somebody taking a hit and like enjoying it, and then you say, oh, okay, well, now I want to go on to the opioids, and you basically said that that is the path to disaster. So it was like this crossroads that you framed of using the same substance to create this gap, and then you can go this way or you can go this way, and they lead to very different places.
Completely. And it's interesting for me, I deal mainly with cancer. So I knew that opiates are a disaster for decades. In fact, I got in trouble in my residency because I probably prescribed less than one handful of patients opiates in my whole career, dealing with cancer. And my hobby was since the 90s to take people off opiates. So I knew, again, I'm not like I was in a position to affect the politics and the greed and everything, but it was clear what opiates do, and steroids also do. They're very different anti-inflammatory. What opiates do is they shut you down. They slow you down, right? You get constipation. And once they shut you down, especially with life-threatening illnesses like cancer, your fighting ability is diminished. So for example, for a cancer patient to get on opiates, it's pretty much the end of the road, unless they get an amazing treatment that just completely, not that some new amazing immunotherapies or whatever, because they have lost their ability to fight. And I've had a lot of amazing patients, and when that were living for years, and the moment that for some reason they got on opiates, you also lose your mind power to be present. And that's when it shifted. So the gap here is an opportunity to take a deep breath. And what we do in this deep breath is our choice. And that's really the value of deep breathing. When we breathe slowly, the gap between exhalation and inhalation becomes more evident. It's very important for pain, right? When we have pain, sometimes if we breathe deep, right, it so well, we feel better. But when is the letting go? It's not when we inhale, it's when we exhale, right? Then at the end of exhalation, there is this gap.
But it's also incredibly important for you to point it out, because the tendency of a person who's in pain is to hold their breath and bear down and tighten up and constrict and isolate, like you were talking about earlier.
And what it does, it creates constriction.
That's right.
It creates fixation.
Yeah.
It creates isolation. Now, what is fixation? What is survival? Survival is not accepting that anything that expresses itself is going to come to an end. That's really what it is. So when we hold our breath, we are holding. It's a survival response, right? When we don't have, if we tell somebody to hold their air, they can be very relaxed, the greatest yogi. After a few minutes, they're going to get stressed because they don't have air, right? This is the process. This is really the profundity of understanding pain. in a deeper way. So the reason why I'm so happy that we're discussing breath, because breath is voluntary.
Sure.
What is not voluntary and easy to do is to train to find the gap between the thoughts. Mm-hmm. And that's a very important mechanism for addressing pain. And in order to find the gap and make the gap available, it's both a mind training, but it's also a physiological training. Because what disrupts this gap is inflammation. What does inflammation do? It swells, right? Right? Everything expands. It interacts with our normal boundaries, you know, in the gut, in the brain, in the tissue. And that's where things that are not supposed to be in space, things that are supposed to stay in space A, move to space B. And then what does the body do? Oh my God, I'm being attacked. It's a new invader coming from the gut. I got to respond with inflammation, autoimmunity, pain. The blood-brain barrier, oh my gosh, I got to respond with inflammation. Memory, Alzheimer, Parkinson, etc., each one with their tendencies. So this is why understanding pain is profound, and working with pain is a real healing opportunity in it.
Yeah, absolutely. So you mentioned in your book that galectin-3 is now raging in our country and on our planet. And we've touched on a few of the things that are contributing to that. Fast-paced lifestyles. You talk about massive exposure to radiation in the book from all these different sources, electronics, phones, EMFs, and you've talked on toxins and their relation to pain. But what is it that's driving this massive surge in galectin-3? You mentioned COVID at the beginning of our conversation.
So I wouldn't just phrase it as galectin-3. I would phrase it that our imbalanced survival is definitely raging. It's part of the increased divisiveness in the world. You know, in ancient times, people didn't interact as much with cultures that were different. Mm-hmm. Right? So there was things were more harmonious naturally, you know? I mean, that's one of the issues with globalization. We mixed elements that don't mix so well, you know? And yeah, we thought we are helping somebody in India by pushing on them glyphosate that will be resistant to weed, but then guess what? They couldn't afford the seeds the next year and they got hungry and starved, right? I was in such places in India when they told me before we had our seeds, everybody helped the other, we had food. Now we can't buy the seeds because we can't collect them because the neighbor bought from Monsanto resistant seeds that moved to our field and we can't do it now, it's illegal, and we're starving. That's an extreme example. So what happened? The struggle, the divisiveness creates inflammation. And inflammation affects not only the inside, but the outside. How do we call it? Global warming. What is global warming? Is heating up of the outside, just like we are heating inside. So when we have more tolerance, when we have more understanding, there is better flow. And when there is better flow, pain goes away because there's more oxygen. And the organ in our body that is responsible for it, it really is the deepest message in the survival paradox. And really the topic of my second book was supposed to be my first book, and hopefully I'll get it out. I wrote it in Hebrew, but with the COVID, I held it. It's called Open Heart Medicine, the infinite healing potential of love and compassion. Why? Because each of us has it. Because our heart survives by flowing, by giving, by taking everything that every organ doesn't want, and instead of fighting, accepting it, all the dirty blood, connecting with the universe through the breath, connecting with the bigger healing potential, and giving clean blood to every organ without discrimination, including the first one that gets blood, so the coronary arteries, is the heart itself. So self-love is part of loving others. When we have this sense, you know, people know when the heart is open, when they feel love and compassion, pain goes down. It's hard to feel loving when there is intense pain. Yes. You can, but it requires a greater depth of meditation training. So this gap that we talked about, we started interesting with anti-inflammatory, and we went to the breath, and now we talk about the mind, because in this gap, when there is no movement, there is stillness, there is evenness, there is less judgment. So with every breath, with every thought, I and you and everyone else has a choice, because not you and not me know what the next thought is going to be. Amazing to think about it.
So you're talking about now the breath the same way that you spoke about using the non-steroidal anti-inflammatory drugs in a very precise way to create that gap, to give you a choice to move in a positive direction.
Yes, yes. And now if people are really, and we actually haven't touched the whole area of toxins. My gosh, it is so important to touch. Maybe we will, but we're kind of a little bit in the area of the mind. So you can pick if you want me to keep going on the mind or talk about toxin.
Where I wanted to go was why that survival response is so big. And I think we can go either way with it, because they're both involved in driving the survival response.
Right. Totally. And what happened, we are bombarded with toxins that were not here. Heavy metals were always in different places, but in much smaller amount. But as we are exposed to toxins, it affects us, first of all, anatomically. Why? Toxin disrupts our barriers. What does glyphosate do? It disrupts the tight junctions in the gut. Produces, as a result, inflammation. So it disrupts the gut lining. Molecules that are not supposed to come into the body come in, and we get an immune inflammatory response.
So let me just jump in for a second so everybody understands that we're talking about the barrier between the gut and the bloodstream is now opened up, and foreign substances can now escape into the blood.
So now they become danger to the body. The same thing glyphosate creates in the blood-brain barrier, right? We always talk about the gut-brain connection. So now heavy metals and other toxins and glyphosate itself, which is so small, it's similar to glycine, the smallest amino acid, penetrate into the brain. And what happens? It drives an inflammatory response, what we call glial activation. It drives an excitatory response. What is an excitatory response? Like people who have attention deficit disorders. What is excitatory? We overreact to a stimulus, which means whatever pain signal is triggered in the body is now going to be exacerbated in our perception.
So you're talking about a central sensitization phenomenon.
Exactly. And as a result, pain will be experienced as a stronger pain. That's really what drives addictions. I often say that, because I did some project on addictions, I didn't have time. I created a plan how to address addiction holistically in my 20s. I presented it in Israel, in Tel Aviv University, but then I traveled to the United States. So I never was able, I had a whole village on how to do it. In any case, what is addiction? Is this moment that we can't handle. If we can take a deep breath, sometimes the whole thing is 5 minutes. And because everything changes. So in this sense, now you got glyphosate overexciting the brain. And then you got glutamate increasing. And then you got toxins. But then you also got galectin-3. So galectin-3, the same galectin-3, disrupts the blood-brain barrier and activates the macrophage of the brain, the inflammatory protective cells of the brain, glial cells, that cause neuroinflammation, which is affecting so many people. Alzheimer's is an epidemic. Memory issues are an epidemic. Yes. So, and we know from studies, the Alzheimer plaque has 10 to 20 times more, not 10%, 10-fold to 20-fold more galectin-3 compared to a normal tissue. When you disrupt the supply of blood to the brain for a short time, what happened in stroke, what happens sometimes during life when we are tight, as you know from your work so much, it's called perfusion injury reperfusion. No blood comes and then it comes back. it triggers in the brain an inflammatory process driven by galectin-3. And in the studies, when you introduce modified cytospectin, you reverse the damage.
Wow.
Now you got the importance of using modified cytospectin, but we also have to address pesticides, because modified cytospectin, and we published, will remove heavy metals and some other toxins, but we have to address glyphosate and pesticide and other mycotoxins. And I have realized in the last 3-4 years that I've done a lot of work on heavy metals, because pectosol is one of the only documented chelators of heavy metals, published, clinical data. But I've really been on a bit of a crusade to find a solution to removal of glyphosate. This is my unique preparation, Glyphodetox. And we're now in clinical testing, but pretty much all the first cases we're seeing a significant reduction in the urine of glyphosate. So I usually don't like to talk about a problem unless I have a solution. It's anxiety, which doesn't help anybody,
Sure. So the modified citrus pectin is showing itself to be effective for removing glyphosate.
No, it removes other toxins, but what removes glyphosate, it's a formula called Glyphodetox,
Okay.
which has different ingredients.
Okay.
But when you combine both of them, you get a larger effect, because you're also attenuating inflammation.
Sure.
And this is why we see people with neuroinflammation getting improvement and etc. But people have to recognize we all are bombarded with pesticide, no matter where we live and what we eat.
Yeah, so there was a study that came out, and I'm sure you would know this information, so I'm gonna destroy it. But they tested umbilical cord blood from newborn babies, and they found that it was like something like 90% of them had glyphosate present in the blood of newborns.
And there are dozens and dozens of different toxic chemicals. In the United States alone, 330 million pounds a year of glyphosate are being used, to 1 pound per person.
Wow.
Now, of course, if you live next to a soy field, cornfield, wheat field, and it's being sprayed, you have much more. And you can see in people spike in the urine in the spraying season. In our test, we took people who live next to these fields, and we showed that we can reduce it.
I also saw some research showing that it was very high in people who live next to a golf course.
Right.
Yeah.
Totally.
Yeah.
Totally, because of the spraying.
Yeah. So you've been in practice for like 40 years?
Almost, yeah, getting close.
I want to dip into your bag of tricks, because one of the things that you talk about in this book would really be interesting to my audience, and that is the injections that you talk about into scar tissue. Where you're using an anesthetic to break what you call the loop between the scar and the brain. And it sounds like you're talking about finding that gap again. And I wonder if you could expand upon that.
Oh, I love this definition. Yeah, it's true. So it's I have 3 chapters about solutions in the book, and one is addressing, it would say healing. In the next edition, I'll change it, healing the scars of survival. So our scars of survival can be physical, it can be emotional, psychological, multi-generational. Just my story of the pain, right? It was a scar of survival of my grandfather. So one of the most important things are physical scars from injuries and from surgeries. And people know they can have a scar that can be there for decades and still bother them, itch or get red. And when there is a cut, when the scar is there, the body is always trying to repair it, because it's not normal to have a scar. Of course, over time, it's less. So it produces growth factors. And these growth and inflammatory factors can affect us in other areas, including production of pain. So what we do when we inject the scar with an anesthetic, specifically with Procaine, and I use some homeopathics, and this is called neural therapy. It's a German method. What happens, and there are different explanations about change in membrane potential, but for me, the explanation is bigger. We are disconnecting the connection between the tissue and the brain. For 45 minutes, the tissue is not sending signals to the brain that something is wrong. And the brain gets to reprogram itself. It gets to reconsolidate a different memory. And what happens in practically 100% of the people is that the scar will get smaller. Some people by 10 to 15%, some people by 80%, which means the scar gets thinner and less bulgy.
Sure.
Here is the amazing thing. This improvement is permanent. It will never go back.
Yeah.
The place where people with severe scars that they gotten decades ago. If I do enough treatment, at some point you barely see the scars.
Wow.
Now, it's interesting for us because it means that things that we thought cannot be changed, can change.
Wow.
The principle and once there is change, pain goes away.
Yeah.
The principle of change is to let go of survival, because survival is fixation and holding. We have close to 50 trillion cells in our body, and each cell knows that it's going to express itself and it's going to die at some point, and another cell is going to come, apoptosis. When a cell goes into a survival mode and decides I'm not going to die, I'm going to create a different environment. I'm not going to listen to the signals telling me it's time to end your journey. How do we call this cell? Cancer cell. That's what happened in cancer. And then the cell says, oh, not only do I want to survive, I want to build a kingdom around me, and I want to be aggressive, and I'm going to take over my neighbors. Cancer becomes, and now I'm going to send messages to the liver and to the lungs and to the brain, and you get metastatic cancer.
Yeah.
That's really the process. It's dysregulation. It's the body loses its harmony as one. Contrary to the fact that we have close to 50 trillion cells, each of them has close to 1 million reactions a second. Can you believe this? So the fact that you and I can talk is nothing less than a miracle. I love to say this because 50 trillion cells with 1 million reactions, it works together. Yeah. How is it possible?
Amazing.
How is it possible? Because it's controlled by our heart. Our heart takes everything we don't want and gives us nourishment. And it keeps doing this. Once it stops, at least this form comes to an end, you know.
Well, you have an amazing take. The what you're doing with scars, your work with galectin-3, the way that you spoke about using prescription drugs like non-steroidal anti-inflammatory drugs in a very deliberate way, and the dangers that you recognized very early in your career from corticosteroids and things like opioids. So we know that prescriptions for these types of drugs are absolutely through the roof, both over the counter and prescriptions from conventional medicine. And we know that they're not solving the problem. So when it comes to pain, what are some clinical alternatives or some things that people can do outside of that model that have shown to be very effective and that you've found to be effective in your own work?
Right. So, you know, there are different methods that are really beneficial that we really want to try. So we have to recognize that in order for pain to get better, the danger signals to the place of pain have to subside. So if we can bring nourishment and oxygen, improve the pH, the biochemistry of the tissue, pain will get better. So one thing is a diet that is less acidic, that creates less changes in glucose metabolism, like anti-inflammatory diets and low glycemic index diet. Intermittent fasting, when we allow the body time to repair. All of these are very important. Then getting the nutrients that will allow our cell to produce energy in an efficient way. So the mitochondria. So different B vitamins and minerals, and use different botanicals that regulate the energy production and as such regulate pain. Curcumin, berberine, and especially honokiol. Honokiol is not so known. Honokiol is from magnolia bark. I don't know if you are familiar with honokiol.
I love that you mentioned honokiol, Dr. Eliaz, because it's one of the ingredients in the formula that I created for pain relief.
Amazing. So let me tell you something. As the only person ever in the world who developed and did a study on honokiol intravenously.
No, okay. Really?
And I had to stop it, and that's why I can share it, because now it's not done. The compounding pharmacy couldn't do it. And I published 3 cases in cancer patients.
Wow.
No matter what was the pain,
Yeah.
opiates didn't touch it. No
Yeah.
matter what was the pain, everybody's pain would go away and they would fall asleep. It was amazing. The whole IV room was snoring. Okay.
Yeah. I saw the studies that showed that the positive effects on sleep, but the main thing was the down regulation of pain at the central nervous system level. So, like you said, it didn't matter where the pain was coming from.
I'm talking about bone pain, nerve pain. It was gone.
Everything.
Okay. So why does it do it?
Yeah.
Because it cancels, it blocks the hypoxia-inducing factor. It blocks mTOR1. It supports AMPK. It is an antioxidant for a normal cell, and it shuts down the abnormal function. So Nokiol works intracellularly, and I published, and I've inventions about it and patents on it. It's much more effective when combined with modified cytospectin, because modified cytospectin will affect the cellular function from the outside, and Honokial will affect it intracellularly. So they work together. We've shown that together they are much more powerful antioxidants and anti-inflammatories. And we have shown that together they also have a much stronger anti-cancer effect, modified cytospectin and Honokial. So I've done a lot. I published quite a few papers on Honokial. And so it's a great combination. I'm very happy that you recognize Honokial. It's an amazing. So it also shifts glutamate to GABA. So instead of having an excitatory phase, it has a relaxing phase. And look, the reason why it's not so popular, because it's not as sexy as cannabis, and you can't make as much money from it, you know? In my opinion, it's actually even a better compound, because it has an amazing safety profile.
Yes.
And it actually helps you concentrate, helps you function better.
Yeah.
So it's very, it's a fascinating compound.
I'm so excited that you mentioned that, because that was one of the substances that I was just over the moon about. PEA was another one.
Right. So yeah, I remember I've been now involved with introducing it, and one of the drivers of it I think for the last 15, 16, almost 20 years. So the other part is anything that regulates our flow. So acupuncture is an incredible tool as a licensed acupuncturist. And craniosacral, just opening the flow.
Sure.
Using chiropractic, and especially what I like from my experience is the neurological part of chiropractic, understanding how you can attenuate the nervous system response. And sometimes it's small things, like even like eye movements, that can make a difference. And so any manual work that creates a flow. Very good hydration. Many people are dehydrated. When you're dehydrated, it changes the pH of the tissue and pain gets worse. In fact, if somebody has acute headache and they drink 5, 6 cups of water, one after the other, in 50% of the time, the headache is going to go.
Yes.
It's simply dehydration that is built up and suddenly it triggers a response.
Yes.
So that's another part. And within it, we use anti-inflammatories, herbal anti-inflammatories have no similarities with an Advil or a corticosteroid. They regulate the inflammatory response. That's why they don't work like a painkiller. So the curcumin, the quercetin, the onokiol, the berberine, and the other herbs or botanical, they have life in them. They create a rejuvenation process, because when an abnormal cell becomes normal, pain goes away. That's really what happens, So all of these are very important tools. And one very simple thing, many pains respond to temperature change. Some pain responds to heat, and some pain responds to cold. It's something I remember I don't know if it was medical school or my internship in Israel, mid-80s, and doctors were arguing if heat is better or cold is better. I told them, look, if you did a study, it may be 50-50. If you ask the patient, it will be 100. Just ask them, are you better with cold or are you better with heat? And if they're better with heat, have them put heat. Now, it's very important. What does heat do? Heat creates circulation. Heat creates movement. When there's movement, there's more oxygen. Cold reduces inflammation. So you use them at different times, or you alternate between them. So all of these are very important tools. And the last and huge tool is how our mind works with pain. And that's a real journey. And it starts with us being able to push the pain away, to kind of keep going and not let the pain trigger an emotional response, a suffering response. That's really, the pushing away is a relatively simple method, but it's limited because we are taking a position. You know, we are pushed, it's not good. We are judging the pain as not good. We are pushing it away. The other part is more mindfulness, when we can be more relaxed and live with the pain. I'm kind of, now everything I'm saying now, so to every level like this is a training in different kinds of meditation. I'm really giving you a life journey.
Sure.
The next level is accepting of pain. When we accept pain, the struggle goes down. When the struggle goes down, we are more relaxed. When we are more relaxed, the pain will get better. The next level is that we transform the pain. We use the pain as a tool to understand, wow, we are in pain, other people are in pain. We open our heart to ourselves and to others, and we create a movement, a transformative movement in the heart. That's when we connect with our heart. And the ultimate level that is very hard to come by is that we realize that when there is pain and there is no pain, there is a certain quality in our existence that doesn't change. It's always there, a certain level of freedom. And in this place, we have a sense of spaciousness in the pain itself, in the thought itself, in the difficulty itself. Now, it's very hard to come by because in order to do this, we have to find, this is when the survivor paradox dissolves. Very hard, but that's where really pain just goes away. That's how, I treated great masters in the Himalaya who couldn't walk and couldn't even sit up, and I treated them. But I didn't do anything. I just used some of my method to connect with their vast healing power, and the next day everything was gone.
Amazing.
Just gone. It was insane. Like diseases were gone. Why? They just let go. So the letting go is really, the journey of life is a journey of letting go. When we let go, we don't hold anything. There's no place for pain. When we contract, it feels painful. I mean, each one can feel it when we contract.
It's so interesting that you bring that up. For the people in the audience that are wary or it feels new agey to them, there's very hard research showing that altruistic behavior diminishes pain.
Yeah, tons of it.
Tons.
Absolutely. This is not new age. I'm the last thing I am is new age. I'm finally starting. It was my flow, because new age has a lot of good things, and because I'm traditionally trained. I didn't talk about it. I spent decades training in Buddhist meditation. I spent 20 years, 2 to 3 months a year in the mountains on my own.
Yes.
The greatest masters in the Himalayas were my patients and my teachers. So I spent 10 years doing a half-day retreat. So, I had a reaction to things that just, new agey, but new age it's great ideas and I respect them. But no, this is science.
Yes.
And science, even if in my personal journey, what drives me is my insight, and science is just a confirmatory act for me.
Sure.
But it's my journey. Other people are driven by science. It's fine. But as you said, there is tons of science that altruistic activity, that an open heart, that compassion alleviates pain, improves health. Absolutely.
Yes, without a doubt. And I'm so happy that you were able to come on and talk about it, because as you said, you're not new agey, but you struck this amazing balance where you can speak the language of both sides and you can use science as your filter. And that I think makes your take on all of this extremely valuable. Where can people find more information about you and your work, Dr. Eliaz?
So they can visit my website, drelias.com and sign up for my newsletter. I have a whole team of writers actually that put a newsletter every week. We put a lot of work into it. And I really hope in the second half of this year, of 2023, to really offer. I do this meditation and healing retreat where I taught thousands of people in Israel. I used to teach here 10, 15 years ago, but I want to do it again. The first one I'm going to do for free on Zoom for a few days, because I know from my experience, especially for people with pain, chronic fatigue, fibromyalgia, how they can get better in a few days. Now, when it's a retreat in person, I've experienced it. But even over a Zoom retreat, if they really take 3-4 days and are willing to take the time, it's really remarkable what happened. And I feel that, you know, I'm in my early 60s, not a little bit more time, I'll already be in my mid 60s. So I really, you know, I started my training at the age 15, wow, you know, in Korea. So really, I mean, it's almost 50 years. So there is some life experience, you know, some knowledge I accumulated in different parts of the world, and I assimilated on my own many times for years before I shared it, especially like insights from meditation, and tried it with patients and on myself. And I feel I have a responsibility to actually share it with others, and so I really hope to do it. And so in this sense, yeah, and they can also find there how to get to my key supplement, especially Pectosol. I really think that modified citrusspectin is the most important supplement to take, because galectin-3 drives aging, drives inflammation, and drives so many health conditions. And there is a way to address it, and it doesn't make sense not to really do it. And when you take modified citrusspectin, it combines very well with anything else that you're taking, and we have studies on it. So really, on one level, I presented today very practical, you know, tools like modified citrusspectin and others, and how to remove toxins. But I hope that I was able to present a little bit of a bigger, multidimensional understanding of pain, its importance, and how to address it.
I think you did a fantastic job of doing exactly that. I want to finish with a quote from your book, which is, while we are all susceptible to certain hereditary illness or conditions, we can avoid many of them by making healthy lifestyle changes. There's a Hebrew saying, everything is predicted, but we have a choice. I want to thank you so much for being here, Dr. Eliaz. This was awesome, and I hope that I can get you back for a part 2 in the near future.
I'll be delighted.
Thank you so much for watching. I really hope that you enjoyed the interview with Dr. Eliaz. If you want to find out more about the survival paradox and the important work that Dr. Eliaz and his team are doing, I encourage you to visit his website. And when you do, he's made it possible for you to access the first 2 chapters in his best-selling book for free online. I was also able to set up a discount code for anyone who's interested in trying his patented modified citrus pectin, and I'll put links for all of that in the description down below. Thanks again for watching. See you next week.